Hello, and welcome back to Office Hours. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. Today, we are talking about a lot of your excellent questions. So, if you are confused about your weight, if you have questions about weight medication, and if you want medically based answers to your weight questions, you are in the right place. Yes, as I was saying about your very excellent questions, I'm going to answer them today. Thank you for sending them in. If you have questions after this, you can definitely leave them in the comment section down below, or you can leave a comment on the video, and I would love to add it to the list. So thank you all for those who sent them in. And if I haven't gotten yours yet, I definitely will. So let's just get started. I am, as always, going to put in the caveat that if your question leans a little personal, I'm going to modify it slightly so it's more broadly educationally applicable. And also, I can't answer personal medical questions because I'm not your personal doctor. So, with that being said, let's get started. Theoretical question about Mounjaro injections. After injecting in the abdominal area, is it normal to ache on that side and feel bloated, like abdominally bloated? I would say no. I mean, the aching, if you've never injected before, if this is a first time injection, yeah, you might, your stomach might feel a little sore in that area. People can definitely get like a little itchy injection site reaction. That usually happens after at least a couple of injections. If somebody injected into the muscle, that could cause some aching. But usually people aren't telling me that they're aching really badly. As always, if you are personally having significant side effects, please reach out to your prescribing physician or your PCP if that's not your prescribing physician. But definitely, if somebody injected into the muscle, that could not feel great. So if you inject too deep, because it's supposed to be subcutaneous, of course, constipation is always a side effect of this medication. So sometimes bloating is a side effect of that. I would say overall, the short answer is bloating, not uncommon, but persistent aching is not terribly common. And anybody who's having that should definitely check in with their prescribing physician or their PCP, but that's not one that I hear a lot about from patients. But definitely bloating in terms of constipation or things like that, people can have. That's not really outside the norm. Next question. What are common treatments for constipation? Constipation comes up a lot for people. This is a very common side effect with these medications. I will usually, it depends on the patient, but I will usually start with the over-the-counter medications first. Again, depends on somebody's past medical history, but there are some, so there's stool softeners like Colace. You do want to get a little, like with any bowel issue, like the more specific you are, the better because it helps you treat it. I mean, like the same with anything, but it's like, is the stool really hard or is it just not moving? Like those are the key differentiating factors. So if the stool is really hard, something like Colace can be helpful. If it's just not moving, sometimes I will treat people with Senna. Sometimes I'll treat them with both. And then sometimes I'll also add Miralax, which brings water into the stool. So it helps kind of move everything along and helps the consistency. So those are three great over-the-counter solutions that I like to use. Sometimes I use one, sometimes I use all three. There are also prescription constipation medications. So sometimes I will use those. Sometimes I will, magnesium is also one that is helpful for people. That's over the counter. And then, but yes, if I have a patient who their constipation is really resistant in terms of over the counter medications and prescription medications, there are some other constipation medications, but at that point, if it's that resistant, I will usually refer somebody to a gastroenterologist because they may need more monitoring for their constipation. And things like Linzess are available, Trulance. There are some other great medications. But, the other thing with constipation is that, nobody likes to talk about this, but the boring things can work really well. And that's really actually the first place that anybody should start if they're having constipation is drinking more water, making sure you're eating a lot of fiber, that's fruits and vegetables, making sure you are moving. Those things all, I know they sound boring, and I know it sounds like, yeah, we've heard it before, but they really work, and you don't have to take a medication. So sometimes I feel like the boring stuff kind of passes right over people's heads, but don't dismiss it until you've tried it because it actually really works well and it can save patients from taking medications. And that's always great. So, those are some of my tried and true fixes for constipation. Okay. Is it normal to plateau between 10 milligrams of Mounjaro and 12.5 milligrams of Mounjaro? Also, do you have any experience with rotating GLPs like Ozempic to Mounjaro? This is a great question. I would say overall, it's important to remember that the weight loss trajectory is not always linear. So sometimes people will just kind of plateau on one of the levels and then it just kind of starts back up again. So somebody might have lost weight very consistently on 2.5, 5, 7.5, and then on the 10, they're like, what happened? And they go up to 12.5 and they start losing weight again. That is not uncommon at all. And, as always, it's helpful to think of the weight loss trajectories like the stock market. Like you zoom out, you can see the whole picture. But if you zoom in, there's lots of tiny fluctuations. So that can definitely happen. It is not unusual to plateau on one or more levels. If you're plateauing for several months, obviously everybody on these medications should be checking in with their physician on a regular basis. But if you're plateauing for several months, you definitely want to be checking in about that. In terms of rotating GLP-1s like Ozempic, yeah, it definitely will change people. I'll change them for a couple, like if I had a patient who was on Ozempic and they went to Mounjaro, it would either be because something happened with their insurance coverage, either they're not losing a lot of weight on Wegovy or something with their insurance changes or they're having a lot of side effects. Those are all great reasons. But yes, I will shift people around if they are not, if, either it doesn't seem effective or they're having a lot of side effects. Those are really good reasons to change. I like to give it a lot of, I like to really give it the full effect. Sometimes you can't always do that because, like, let's say there's a supply chain issue. Sometimes you have to be a little bit more nimble. But all things being equal, yes, I like to, if I had somebody on Wegovy, I'm thinking about changing them to Zepbound. I would change them to, I would have them go all the way up. I would have them go all the way up to the highest dose of the Wegovy before changing them over to the Zepbound if I could. This is about a generic weight medications. I don't know if this makes sense. Not anything was covered for me, let alone the only way to get anything covered. Okay, so this person who wrote in, their doctor was going to do Contrave and she was going to do bupropion and naltrexone separately. I don't know if that makes sense because no GLP-1 is covered. And the only way to do the Contrave is to do them separately. And I'm not sure how that goes. Even bariatrics is not covered. Okay, so essentially, it sounds like this person is their insurance is not approving a lot of things for them at all, not approving bariatrics, not approving GLP-1s, and they're saying that their doctor was going to prescribe Contrave, but separately as the generic components. And yes, the answer to this question is that is a very acceptable way to prescribe to kind of construct Contrave on your own, because Contrave, which is, and I've made videos about this, Contrave is is not generic. It is a combination medication of bupropion and naltrexone. However, both bupropion and naltrexone are generic medications on their own. So let's say your insurance, let's say I have a patient whose insurance doesn't cover Contrave, I can prescribe them both separately and kind of and approximate the doses and get a very similar effect. So that is a very legitimate way to go about kind of a good workaround, and can be a lot more affordable for people. And I've definitely done that before, and it's nice to be able to have that to offer to people. And it's the same with Qsymia, which is phentermine and topiramate. Qsymia is a combination medication, but you can co-prescribe them in approximately the same type of doses to get a very similar effect. So it's always nice when we have those options, because some people, their insurance is just very difficult and they don't approve a lot at all. So good luck to that writer. And that is going to do it for today. So thank you so much for watching. Thank you so much for your questions. If you have more questions, please leave them down below. If you want to work with me directly, you can find that information down below. Thank you so much for watching, and please be well.